I am Veronica Schoch, and I have the pleasure to moderate this webinar organized by the Global Health Advocacy Incubator to celebrate the World Heart Day. Based on 25 years of experience, the Campaign for Tobacco-Free Kids launched the Global Health Advocacy Incubator several years ago to expand the public policy agenda beyond tobacco control and using the same approach to address different policy priorities, like food policy, cardiovascular health, road safety, among others. Today is the World Heart Day, and the Global Health Advocacy Incubator community wants to highlight the importance of the continuous civil society advocacy work to support public policies for the prevention and control of cardiovascular disease, which is the leading cause of death that disproportionately affects the most vulnerable population. The cardiovascular disease is preventable, and a key component of its prevention is the policy promotion for healthy environments and the regulation of unhealthy products, like tobacco products, alcohol, ultra-processed food and beverages with high level of sodium, sugars, fats, or trans fats. These measures that are critical to protect the human right to health should be based on best scientific standards and should be free of conflict of interest. Much progress has been made until now, but there is a long way to go. GHGI Cardiovascular Health Program is one of the global partners of Resolve to Save Lives, an initiative from Vital Strategy, and we work together to promote policies for the elimination of trans fats, the reduction of sodium consumption, and the strengthening of health systems to improve hypertension control. Today, to celebrate the World Heart Day, we want to share experiences and lessons learned related to trans fat elimination campaigns around the globe. Why we chose TFA campaigns to celebrate this World Heart Day? First, because the industrially produced trans fats are a demonstrated cause of heart disease that could be prevented if the governments continue enacting regulations to ban or limit them and replace them for healthier options. Second, because the World Health Organization has called for a global elimination of industrially produced trans fats by 2023. And last, because our CDH, our cardiovascular health program that was created only 4 years ago, has been working until now in 11 countries, supporting TFA comprehensive civil society advocacy campaigns in the Philippines, in Turkey, Bangladesh, India, Nigeria, Ethiopia, Brazil, Argentina, and more recently in the East African community in Kenya, Uganda, and Tanzania. In 2021, and in the middle of the COVID-19 pandemic, India and the Philippines approved TFA regulations based on the highest scientific standards. These were amazing public health victories, and we congratulate their governments and civil society organizations for their leadership. This virtual event will showcase lessons learned from trans fat elimination campaigns in these countries, India and the Philippines, and introduce tools developed by GHGI to facilitate trans fat research and advocacy around the globe. We will have two distinguished advocates from Consumer Law in India and from Imagine Law from the Philippines that will be our panelists. They will be preceded by Hema Kanchandani, our GHGI colleague, who is the Associate Director in charge of the CDH program in our organization. And then we will have a discussion panel integrated by advocates from other countries in the world that are currently developing campaigns to support TFA best practices. Then we will have a panel discussion, and we will open the floor for questions and comments from the audience. So please do not hesitate to write in the chat box your questions or comments. Hema, the floor is yours.
Thank you so much, Vero. Hello, everyone. Thank you so much for joining us today. As Vero had mentioned, I'm actually going to spend a little bit of time sharing with you the GHAI advocacy framework. Hopefully that will set the stage preceding our wonderful guests, advocates who are going to be presenting afterwards. If we can just get the slideshow, that would be great. Thank you. So this is actually just a quick diagram about our approach on advocacy. And it's sort of segmented, but I'll get through each of these and just sort of explain how we operate. So first and foremost, we take a proven systematic approach to support locally led advocacy campaigns. And these are usually customized to address the local context and needs. We are actually always focused on delivering health policy wins in countries around the world with diverse political systems. So in the first box right here where you see assess, it's really about assessing the needs. So it really does begin with evidence and intelligence gathering. We identify, assess, and support the capacity of local partners. And then we move on to the next piece, which is plan. And through the assessment of legal, policy, and media landscapes, we're able to identify the policies that must be changed. And a part of this process also includes identifying the necessary decision makers and stakeholders whom we can engage to be able to advance our efforts. The third piece is where we provide financial, strategic, and technical support to our partners as they run a comprehensive advocacy campaign. We usually employ various different advocacy strategies, which include engaging policymakers, so that's more decision maker advocacy, media advocacy, coalition building and mobilization, and monitoring and countering industry opposition. And then finally, once the policy has passed, we continue working in collaboration with local partners for strong implementation, enforcement, and ownership. We monitor progress and support public health sustainability. Now, this is basically a diagram that's generic to our organization at large, but it is very important to take note of the fact that we do have to tailor our approach based on the policy and the policy needs within the country. If we can go to the next slide, please. So we just wanted to share with you that GHAI has developed various different technical resource materials to help countries with their approach to TFA. We start with the first document, which is on the top. It's the center. When you're starting off as a country and you're really trying to figure out what your approach will be, the key considerations for regulating trans fat document is a very useful document to kind of walk you through what is the situation in your country and what approach should you take. And then below them, you can't really see the titles, but we have a guide on how to map the partially hydrogenated oils, the market mapping process. And we also have sampling protocols for TFA chemical analysis. So that's it from me. Over to you, Vero.
Thank you so much, Gemma. We apply as GHAI that approach when supporting locally led campaigns in different programs. Thank you for sharing, and we invite you to visit the website to see the materials we prepared. Now I have the great pleasure to introduce Ashim Sanyal, who is the Chief Operating Officer and Secretary of Consumer Voice, an NGO working for consumer awareness and education in India. Ashim has been working in many campaigns focusing health, in tobacco control, in road safety, in nutrition, and many other topics. And he has been in charge leading Consumer Voice since 2007. Ashim, the floor is yours.
Thank you, Vero. It's a pleasure to be a part of this discussion on a very, very important topic of today. In fact, that's elimination of TFA, or chemically produced trans fatty acids. So the road to trans fat elimination in India started actually way back in 2009. When Consumer Voice got hold of a few documents and a WHO recommendation, in fact, for elimination of trans fat. But the first step that we took in terms of our action plan when we submitted documents to the authority then, in fact, which was not fully established, that is the Food Safety and Standard Authority of India. So we submitted to Ministry of Health a coalition of documents, in fact, which was looked cynically by them, saying that it's not an important subject for us to discuss at all at this particular stage. So we decided as a next step to actually test the market, in fact, and so we went on surveillance testing across the country. In fact, we sampled the PHOs as well as products, in fact, and published a result report which was indicative of presence of over 56% as the maximum percentage of trans fats in any food item that was sold, in fact, including the PHOs, in fact. So that was a clincher for us in terms of going back to the regulator and the authority, saying that, look, we have enough evidence to say that the trans fat limits are way beyond control, and we need to control it. We never said eliminate it, we need to control it. So a meeting was called by Ministry of Health at that point of time with Food Safety and Standard Authority as a regulator there. And it was decided in 2012, in fact, that we will have a limit. That was the first victory sign, in fact, and we will have a limit. But what is the limit? There was, again, a series of stakeholders meeting, which was overwhelmed by industry presence, and we were in minuscule number as civil society, but we fought on our battle and brought down the limits to 10% capping, which was opposed to the nail by the oil industry, and the actual implementation of the same was in 2013, in fact. So in 2013, India had a policy, trans fat capping policy of 10%, in fact. And then we came down to another round of discussions with the government at a given point of time, where WHO also flagged off this issue as critical issue, in fact. And in India, NIN and ICMR also published reports. We utilized them and went back to the authority, which was fully established then. And we asked for elimination of trans fats. Again, industry pressure, and ultimately the authority decided that we will bring it down to 5%, and in 2015, in fact. And again, there was industry pressure, and ultimately it was implemented in 2018. So you see all these stop gaps, in fact, which pose a great challenge for every notification and every implementation. The real launch of trans fatty acid elimination came when we managed to include the trans fats elimination program in the national program of Ministry of Health, which is called the Eat Right India movement. It was a campaign, in fact, which was a field campaign for 6 months, where we participated with banners, etc., for elimination of trans fat, amongst a lot of other things of concern to health. But then this was flagged off as a national campaign. And once we inserted this in the national chapter, the road towards the end became very easy for us to manage, because it was the ownership got transferred to the government. So I think the push on from there began, and 2018, when WHO actually declared their intention to have zero trans fats by 2023, there was a bold declaration by Food Safety and Standard Authority of India that India will actually achieve the goal 1 year before the target, that is 2022. So that was a hallmark where pledges were taken from all companies, multinationals as well as MSMEs, the PHO manufacturers, in fact, also participated in that. It was a big show inaugurated by the minister himself. And that was a moment where we thought we have had our victory, in fact, in terms of having a zero trans fat limit, in fact. We pushed FSSAI to actually notify those standards in 2020 in terms of the notification of trans fat to 3% by 2021, and 0% or 2% from common parlance, in fact, from 2022 January, which is fast approaching. So this is in black and white, and as a Gazette notification for us. It's important for us, therefore, is that this notification is an important landmark for not only India as a country, in fact, but civil society organizations per se, who fought on for a decade to bring on a capping first and then eliminations of trans fats from the food system or the food chain, in fact. This has been muddled up with a lot of ingredients, in fact, and the first was, of course, media. The media and social media played a critical role in terms of highlighting our need, our ask. And if I may very bluntly say that even now today, trans fats are pretty much unknown to common consumers. They could not understand trans fats fully and what is the harmful effects. In fact, so a campaign was run simultaneously to with IC material to actually inform consumers and make them a stakeholder as a part of a campaign. Next, basically was a step in the right direction in terms of sensitizing the members of parliament. I think this was a critical step again, where we felt that FSSAI is going a little slow pedaling in terms of its notification. We actually engaged a series of over I would say 50 parliamentarians, in fact, at various stages and from both houses of parliament and cutting across party lines, who actually were explained critically what is trans fat, why is it bad, and this led to a lot of I would say urgency for the regulator and the Ministry of Health. In fact, more than 30 MPs were actually on board supporting us on an everyday basis. There were over 10 questions asked in the Houses of Parliament on trans fat position from the government, and government was forced to give an answer. And more than that, in fact, some of the MPs, I won't name them because you won't know them, but then some of them very well-known MPs supported us effectively on Twitter chats, on social media platforms, and some of them retweeted and liked also our posts. So I think media and social media, along with the members of parliament, played a very crucial role in our campaign for trans fat elimination. I think critically, I'll end with some of the, I would say, roadblocks which are common to each and every country, should be common to each and every country, is the strong resistance by, here we have 7 large oil manufacturers federations. In fact, there were tooth and nail opposition from them right from the beginning, in fact. So it is obviously PHO, Vanaspati industry manufacturers, which is a large sale quantum value item in India. So they raise the bogey of, again, livelihoods, again, trans fat acid being blown out of proportion. It is not a health harm to an extent. It can be controlled, and that we have a control measure now of 5%. There should not be any further action plan. So, I mean, the bakery and confectionery industry obviously were very alive, and they were determined to block our way, in fact. And generally, fast food and street food companies and vendors were opposed to that, because obviously they talked about the pricing aspect very critically. In fact, they wrote to Ministry of Commerce, the Prime Minister's office, and we have seen a spate of letters going out from all sources in the industry, in fact. So the industry support can not be expected in terms of any move that we make, and any regulation for healthy systems, in fact, which are good for consumers. They will oppose it, and we have faced a lot of opposition, but glad to inform and the closure that the scientific documents, the research papers, the findings, the WHO advisories, the help that we got from GHI in terms of global best practices, they all brought together a piece of documentation in terms of evidences that could not be nullified by anybody, in fact. So, and as a closure statement, I must say it's a tough job to bring in any regulation, be it trans fat or anything. But if you are determined, if you have the will, and if you can garner support of all stakeholders, this is a possibility. Thank you very much. Over to you, Vero.
Yeah, thank you so much, Ashim. This was really nice to hear and interesting I highlight from what you said that how many pieces in the campaign were essential to really move forward and achieve the policy change. And you mentioned the civil society coalition and strong collaboration with FSSAI and the government leadership for that, but also the media engagement, the parliament engagement, the strategies to counter opposition, and also the existence of WHO standards that put in the agenda the issue and facilitated the process. Thank you so much. Now, then we are going to have some conversation and discussion, but now I am going to introduce Marianne, Rosales, Santo Domingo. She is a public interest lawyer from the Philippines. She is currently the project manager of Imagine Law, a nonprofit civil society organization in the Philippines that develops and advocates for evidence-based public health policy solutions. Ms. Rosales, Marianne, leads Imagine Law Healthy Diet Project and currently works on trans fat elimination campaign. So please, Marianne, go ahead. The floor is yours.
Hi, Vero. Thank you for that introduction. And hi, everyone. Good evening from Manila. I am, again, Marianne Rosales, and I work on trans fat elimination in the Philippines through my organization, Imagine Law. So before I begin talking about the work that we do here, I wanted to paint you a picture of the NTD burden carried by the Philippines right now. Currently, we are at 100,000 cardiovascular deaths every year. That's about almost 300 deaths every day, and almost 11 Filipinos dying every hour. So by the end of this webinar, 11 Filipinos would have died from cardiovascular diseases. So we know that the burden of disease is heavy. And to alleviate that burden, we're always looking for simple and straightforward policy solutions to be able to address that situation. And that's why we turned our eyes towards trans fat elimination. First, we conducted a legal and institutional assessment to be able to determine the policy gaps in the policy opportunities to introduce trans fat policy. And we were able to determine that, in fact, our Food and Drug Administration had the authority to issue regulations on trans fats, but were limited in such a way that they only covered prepackaged food, and also that they needed health policy direction to be able to issue such regulations. We were also able to determine that our labeling regulations were not as strong, and our monitoring and evaluation processes in terms of implementing labeling policies could improve more. And so with this, we were able to devise our policy strategy on how we're going to go about regulating PFA. But alongside that policy assessment, we also conducted a PHO market mapping study. We were able to map out the sources, the processes, the distribution flows, whether it's imported or local, and who were the local manufacturers of PHO in the Philippines. And that study revealed that, in fact, in the Philippines, the PHO market as a standalone oil is very small. This is the product of course, the global movement on trans fat elimination. And it's also the product of the reason because there's only one local PHO manufacturer in the Philippines. We were also able to determine through the mapping study that about 50% are sourced locally, and about 50% of our PHOs, as standalone oils, are imported. And with these data, with this information, we designed our policy and advocacy strategies. So given what I've mentioned, we already know that we have our FDA that can issue our regulations in terms of prepackaged food. But we know that there are other food sources that are outside of prepackaged. There are food establishments, there are traditional markets, there are non-traditional markets. And so we wanted to be able to capture as much as we can so that nothing falls through the cracks. So how we design our strategy is a hybrid between a PHO ban and a TFA limit. Right now, our policy as it stands, as issued by the Department of Health just last June, is that partially hydrogenated oils are not allowed to be manufactured, imported, distributed, and sold in the Philippines. And food products with a TFA content of more than 2 grams per 100 grams of fats and oils are also prohibited. Now, we also know that if the FDA issues regulations, they would only cover this much prepackaged food. So to be able to cover that whole spectrum, we needed a law, we needed legislation. But as advocates, we know that legislation takes long. And so we were able to determine that there's another route, which is an administrative route through the Department of Health, by issuing a national policy that lets us focus first on prepackaged food, but sets up the stage for this local and for this national legislation to take form. And so that's how we went about. Now, given the policy strategy, how do we deal with the advocacy part? And this is I guess this is the more fun part of the work that all of us in this room do. And in terms of advocacy for trans fat elimination, it's quite difficult because it's a technical issue. And we know that it's very scientific. It's not easy to visualize. It's not easy to describe. And we know that it's hard to sell something that you cannot see. And so we determined our advocacy strategy and designed it in such a way that we can make use of sensory evidence. So what do I mean by this? We paint pictures. We did a variety, a whole spectrum of different types of advocacy activities, from conducting a taste test between two food items. These are donuts in particular. We conducted a taste test of 2 donuts cooked with PHOs and cooked with healthier alternative oils. And we asked our policymakers who were attending our webinar, our policy webinar, to taste the difference between PHOs and alternative oils. They were able to determine that it's very, very subtle, if there is any at all. But we emphasize that that lack of difference that they fail to notice there is felt through the heart. And only our heart knows that difference. And that activity was able to mark in our policymakers, and they still do remember that to this day. We also did cooking demonstrations by showing how ingredients with partially hydrogenated oils can be replaced with healthier alternatives. We also have a children's storybook on trans fat elimination, talking about the story of a child whose father sells street food and uses and reuses oil and uses shortening and margarine in the development of his product, but that he suffered a stroke, and how this whole story of this father and daughter turned about. So these books were distributed to legislators, to policymakers, and we were asked to for meetings with them, showing them this book and showing them our story. And then we also did, we made sure that our champions have the right tools. We conducted policy analysis and design workshops. We conducted facing the media training, which are sessions designed to train our spokespersons to face the media and answer questions from media practitioners. We also had journalist training in media fellowship. So all of these things, when they all come together, paint the picture of what trans fat is and why it's important to regulate it. And then lastly, it's about creating symphony. It's about building relationships and building trust. We made sure that a key area or a key strategy in our advocacy is building a coalition of health advocates, of experts, of policymakers, even of media practitioners, of the youth, that are all involved in health promotion and healthy diet promotion. We conducted joint communications activities with the government, with our Philippine Department of Health. And more importantly, we also collaborated with them on non-TSA policy areas. We were able to work with them during COVID-19, when of course the world stopped last year around March for the Philippines, when we were on lockdown. All in-person events had to be shifted to the virtual, and it was very hard for us to adjust. But because we worked with our partners, particularly our government and civil society partners, on other areas that are non-TSA related, they reached out for us for support on COVID-19 response. And this enabled us to continue working with them on the TSA policy. And now we're here. The Department of Health has just issued a national policy for trans fat elimination in the Philippines last June. And we are waiting for the issuance of regulations implementing this national policy within the year. And then we have our bills that are currently filed in both houses of Congress. In the Senate, the upper house, we've already received approval from the Senate committee that hears the bills. And in the House committee, where the bill has already been approved in principle. So all of these things, just to close my sharing with you, is that it's very important to build powerful stories. It's important to tell your stories in a compelling way that would reach your audience where they are. And it's very important to have strong linkages, strong partnerships, as well so as to build champions for your advocacy. Because after all, we're not working on this alone. And that's it. That's it for my presentation. And I hope to see you in a trans fat-free, heart-healthy world by 2023. Thank you, Vero.
Thank you so much, Marianne. This was very inspiring, and I like this last comment you made about the building compelling stories to engage different stakeholders. And also, I highlight the issue you mentioned about how important it is to build coalitions of different civil society organizations, stakeholders, and in the case of the Philippines, the strong collaboration with WHO to support the champions in the government. That is really critical. And also, I highlight the fact that you mentioned a comprehensive landscape and political analysis as a baseline information required to shape a very smart advocacy campaign to really be tailored to local needs and local context. So thank you so much. I have a question for you, Ashim, before showing some videos that we receive from other advocates from around the world that have questions for you. And I wanted to ask you, the regulation process was finalized in India in February when the regulation was approved by the FSSAI. From then, you have been working in the second phase, in the implementation phase. Can you let us know a little bit about your experience and lessons learned and challenges related to implementation, please?
Yeah, thank you. I think it's a very good question because no regulation is complete without implementation. I think this is something that we believe in as advocates working in any field. So the implementation of TFA basically came from the civil society itself. The government was lethargic enough not to do anything after passing the first regulations of 5%. So I will basically say that Consumer Voice did an implementation program themselves, in fact, in terms of 4 stages of testing products as per protocols in NABL accredited laboratories, where we picked up samples from the market, from the PHO themselves, in fact, and we tested these samples in a NABL accredited laboratory, got the results, and they were fairly comfortable results as far as the regulation following is concerned. But we personally felt that we are not doing enough in terms of making an impact in the market. So that's when we had a long discussions with the Food Safety and Standard Authority of India that before we embark upon the 3% journey, in fact, we must test samples by the authorities through the state authorities, because health is a state subject, and going to the states as a civil society organization and getting them involved in it will not work unless the authority decides to do so themselves, in fact. So we could convince FSSAI to actually ask their state members, in fact, the food commissioners of different states, and I'm a member of Central Advisory Council, where it was minuted also, in fact, that they would undertake this job within 3 months' time, in fact. So there were 2 studies done by FSSAI, in fact, one on 5% and one on 3%. The 5% results were partially done by us in terms of sample collection. We helped them, and they did the laboratory analysis, in which it was made very clear that the maximum range of food samples that were collected were up to 4.8%, which is still below the 5% mark. In fact, only few samples just falling just over the 5% mark, which said that the companies are following the regulation of 5%. The 3% regulation implementation study was done completely by Food Safety and Standard Authority of India by collecting 1,816 samples from 18 states of the country and testing it in the central laboratory after getting the samples. And the results are just about out, in fact, a week, 10 days back, and which says there is a 2% failure of the samples, in fact, of 3%. So I think basically these 2 results give us enough hope that the industry has basically modified their technology. They have implemented a certain strategic movement in terms of the game changers to reduce trans fats also very importantly, and this came from the industry person himself, in fact, a large PHO product are exported to different countries. Now, with many countries coming up with PHO or trans fat regulations, in fact, it was imperative that the industry do it for a selfish reason, or I mean, besides the national reason. So they have had to adopt because their export otherwise would have been hampered to many countries. So there were two main reasons for them to adhere, and I'm glad to announce that the 3% also there is a almost a complete adherence, except for a 2% bifurcation from the on the non-adherence side. So the implementation part, again, I would emphasize, is a joint operation. You cannot just leave it on the authority or the ministry to do it. You have to handhold them. You have to support them, like we did, in fact, and we took. We had to bear all the cost of collecting samples, etc., going to the market, sending people to the market. We did that for a cause, because we knew ultimately it's going to help us. So again, we were selfish too. In fact, if the industry was selfish, we were selfish, but then ultimate result is a win-win result. Thank you very much. Over to you, Vero.
Thank you, Ashim. This is really inspiring and interesting. And we know that there are challenges for implementation, but also it's so important to really protect hearts, to have regulations fully implemented. Marianne, could you please let us know a little bit more about your experience in engaging the media and the media strategy your organization and the other members of the coalition follow to engage different audiences for these compelling stories you were talking about? How did you work with the media?
Thanks, Vero. Well, you know, we firmly believe that well, as advocates, it's easy for us to forget that not everyone we meet will always agree and always believe in the things we believe in. So we need to be able to have storytellers to help us translate and communicate our messages, be able to bridge the gap between the technical side, the policy and advocacy side, towards that which will compel and urge people into action. And this is how we've always engaged media. We've always been, from the first year when we started in 2018, we conducted our first journalist training and media fellowship. And we've been at it for 3 cycles now. And every year we learn something new. We learn to adjust according to the types of audience that is also evolving. Maybe just very quickly, for example, we started with purely articles, news articles, journal articles, investigative articles. And right now at Cycle 3, we have a hybrid of different media outputs, digital outputs. We have books, we have TikTok videos, we have comic strips even. So we try to always reach our audience where they are. And I think that's how we've been able to elevate the discourse on trans fat elimination.
Thank you so much. This is really, really useful and again inspiring. And now we are going to have some recorded messages from advocates around the world, from Bangladesh, from Argentina and Nigeria. So we are going to hear their messages about the campaigns they are doing and a question for the panelists. So please go ahead with the video.
I am Ruhul Quddus. I am a public health advocate working with Global Health Advocacy Incubator to support trans fat elimination in Bangladesh. Bangladesh has one of the highest proportion of trans fat related cardiovascular disease deaths in the world. The total number has been rising steadily to more than 12,000 in 2019. And yet for the longest time, there were no efforts to limit trans fat in food. That changed in 2018 when government and civil society advocates began to explore ways to eliminate industrially produced trans fat with support from GHI. Since then, a comprehensive advocacy campaign has been mounted by civil society led by National Heart Foundation, Consumers Association of Bangladesh, and PROGA. Together, they have engaged high-level decision makers, consumer groups, stakeholders, published a charter of consumer demands, trained 120 journalists, and catalyzed 1,700 media stories on the urgent need for trans fat elimination, and also used digital media to amplify supportive voices. As a result, Bangladesh Food Safety Authority has drafted a regulation limiting trans fat to 2% in all fats, oils, and foods. The draft is going through the vetting process now, and we hope it will be finalized shortly. Civil society advocacy was absolutely critical to create environment for this policy change to happen. I have a question to the distinguished panelists. A study in Bangladesh revealed that 92% of partially hydrogenated oils sampled in Dhaka city contain trans fat levels above the 2% limit recommended by WHO. How these trans fat research findings can be beneficial to global policy advocacy.
Thank you so much, Ruhul. And I would like to know your opinion, Marianne, related to, you mentioned something that maybe you can flesh out a little bit more about how was, which was the role of the research, particularly the PHO market mapping for the design and development of the campaign in Philippines.
Thanks, Vero, and thanks, Ruhu, for that question. I think it's very important really to build your case. Before, of course, you come to Congress, you come to policymakers, you have to have a strong evidence base. In this, for example, in the Philippines, the PHO market mapping study provided that strong foundation for our advocacy, in that it was able to define and shed direction into how we're going to design the policy. As I mentioned earlier, through the PHO market mapping study, we were able to determine that 50% of our PHO as standalone oils come from domestic sources and the other half from imported sources. And because of that reason precisely, we decided that the policy should be a tandem or a hybrid of the PHO ban and the TFA limit, because we wanted to guard both from internal as well as external sources or threats. And that's how important PHO market mapping studies are, and any research for that instance is.
Thank you so much. We can move forward with the following question coming from FIC Argentina.
My name is Luciana Castronuevo, and I work at FIC Argentina. I would like to briefly comment on the TFA campaign we are conducting in our country. Our campaign includes not only health organizations, but also human rights and consumer organizations. Argentina passed a TFA policy in 2010, becoming one of the first countries in our region to have a TFA regulation. However, this regulation does not accomplish the best standards, and it is not enough to guarantee the right to health of our population. That is why, since February, we have been working on a campaign to achieve the best TFA standards. We have conducted different activities in order to define the content of the policy and also the best political strategy. Based on all the data collected, we decided to submit a proposal for the modification of the Argentinian Food Code at the National Food Commission, CONAL. We propose a hybrid model which includes a 3% limit and also a PHO ban. A communication campaign was also launched not only with the objective of raising awareness about the health damage of TFA in population health, but also in order to mobilize to action decision makers, particularly those who are part of CONAL. During all these months, we realized that the fact that Argentina already has a regulation imposes relevant challenges to our campaign. In that sense, we could consider very helpful if the panelists could tell us a little bit more what advice do you have for advocates working to improve already existing trans fat regulations that do not meet international best practices.
Thank you so much, Luciana. And I would like to hear from you, Ashim, because in Argentina now is the same situation that happened in India, where they are working in an advocacy campaign to move from the 5% to the 2% limit, which was similar in India. Could you please answer this question?
Yes, a very good question. In fact, any half-hearted approach to legislations is, as I said, adventure, and many times government do that, regulators do that. In fact, as I mentioned in my presentation, in fact, we picked up the thread from the 5% mark, in fact, where we felt that we had a long journey to yet to go, in fact, to make it 0%. So it's a boon actually to have a regulation already in place, but not a complete regulation in terms of the actual requirement, in fact. But then one can carry forward from there, in fact, and basically ask the regulators or the health authorities that why was this particular level reached? So you cut out the complete justification part of it from it, why trans fat regulation is required. So having cut out that long journey, in fact, you have a simpler way of approaching the thing. In fact, that from a particular percentage, you have to reach 0% in terms of the WHO. In fact, so the strong book would be the Bible would be the WHO regulation. I mean. Advisory, that is, you have a 2023 advisory from WHO, you should utilize that. And I think it's a very, very good situation for any advocacy group to begin from at least not a 0 mark, in fact, but at least half a mark. So it's good luck to you, and I think it will be a short journey.
Thank you so much. And last, we are going to share the message recorded by our colleague from Nigeria.
On this occasion of the World Heart Day, we from Nigeria at the Network for Health Equity and Development join the Global Health Advocacy Incubator and all the global health advocates to celebrate this occasion. The theme for this year's World Heart Day is one that is closely aligned with the work that we're doing, and as global advocates for health, we believe that the work we're doing in Nigeria for the elimination of trans fatty acids is one that really contributes meaningfully to reducing the burden of heart disease in the country. The question for the panelists as we go through this dialogue is how health advocates, can reach out to key policy and decision makers during periods such as the global COVID-19 pandemic, and during periods when there are severe economic challenges and other priorities, such that the issues for which health advocates are advocating can also be elevated to equivalent levels of priority.
Thank you so much, Sharon, for this important question. Both could answer this question. Would you like to answer first, Ashim, about the experience, how you frame the campaign in the Indian context in the middle of the pandemic?
Very valid question, and I think often asked question. I would answer this by simply stating that COVID has actually upped the ante in terms of the health harms, and people are looking for health. Authorities are talking of health. They are working on the health grounds, and COVID has given us a unique opportunity. In fact, despite all the damages that it has done, that it has pushed up the agenda for health, in fact, and it's probably one of the best times that we have worked with the health authorities. In fact, of course, working for COVID and working on other issues related to health. So it's actually, if in my opinion, a golden period for us to take up the issue of any health issue that we think is adding up to the burden of COVID, to the pandemic, and definitely trans fat is one of them, in fact, causing cardiovascular diseases. And so this is one thing that will be listened to at this stage, I feel, much better than when people are busy with a lot of other activities.
Thank you so much, Marianne. Something to add?
I'm here. Thanks, Vero. I completely agree with Ashim. I think that out of different types of advocacies, the impact the COVID pandemic, because of how it's structured and its effect on how people who have comorbidities such as cardiovascular diseases present this opportunity for advocates like us to bring to push the advocacy and the issue higher up in the agenda. But I think part of Jerome's question also is the general conflict, or the general problem of having to compete with all of these different priorities of government, because COVID has taken up so much of government priority, of government resources. And I think to answer that, I would say that it's a matter of staying relevant. It's a matter of making sure that your government partners know that they can rely on you, not only on matters that are important for your specific campaign, but also in this whole spectrum of public health and health promotion. In particular, we do not work just specific on our projects, or we do not work just to pass specific legislation or policies. In fact, the work that we do is a work meant to save lives. So whatever it is that is passed to us, that is thrown at us, then we work at it and we work with this community with it. And that's how I think you can still push even in despite of this pandemic. Back to you, Vero.
Thank you so much. This is really useful, and also because NCDs has been demonstrated to be a risk factor for COVID. That was a huge opportunity in many countries to use for the campaigns and to connect the different components of public health. Gemma, do you have questions from the audience you would like to raise to the panelists, or your own comments? Please go ahead.
Thank you so much, Vero. Yes, we have a number of questions coming from the audience. I'll start with the first one that actually came in. So this is actually a question for Marianne. Do you have any pointers on public litigation specifically targeting the elimination of trans fat? This question comes from Kabanda David, and he is asking this question because he is litigating a case against the failure of government to regulate marketing of trans fat products to children, and has been asked by court to draw a direct causation.
Thank you so much for that question, Kabanda. And first of all, I'd like to congratulate you for taking on such a very significant case. Well, frankly, I personally do not have experience in public litigation. However, our organization has been involved in their personal capacities and in other capacities in public litigation related to tobacco control. I'm more than happy to send over some references for you. But specific to your question here, I think it's more of a legal issue than strictly public health, because I think what you're being asked of here is demonstrating actual injury, and that is, I think, would depend on the laws of each country where you're working in. So that would depend on the more legal rules. But nonetheless, I'm more than happy. I already noted here your email address, and I'll reach out to you after regarding other references that I may have. Thank you. Thanks, Emma.
Yeah, thank you so much, Marianne. We have another question. Do you have any pointers? And this question is for anyone. Do you have any pointers on coalition building specifically targeting elimination of trans fat? And perhaps, this is, I actually had another question, so this is maybe a follow-up to that, is just, any tips or pointers around lessons learned as you've started to build the coalitions in your own respective countries?
I'll try and answer that in a very simple way that, first you have to be a trusted organization whose causes are believed in by your stakeholders. I think that's a primary requirement. In fact, that your organization should have had experience in working on various fields which are for public health or other causes, in fact. And stakeholder building is an exercise by itself. It will take a whole session to actually go on that particular chapter in terms of stakeholder building exercise. But the critical aspect of stakeholder building is you have a like-minded organization who believe in your cause and are willing to join you or in either a geographical location or at a national level. And these need not be your partners. Their stakeholders can be the media people, can be a stakeholder, the member of parliament, or the other stakeholders can be celebrities and others, in fact. So you can have a whole set of stakeholders supporting your cause, as is normally done. If you analyze any advocacy effort, in fact, you will find that you have a stakeholder mapping of many different heads, in fact. And this is an important thing, that you do not have you do have a particular presence in a particular advocacy case where the support base is pan national. It is basically divided into rural urban divide. In fact, it is also divided between the low middle class society, which actually has the largest population. In the end, to showcase this particular stakeholder mapping, in fact, you ultimately have to show their support. So any issue that you raise, for example, today we are having most of probably that we are having a Twitter chat in India, in fact, where the stakeholders are coming from all over the country. In fact, it's going on right now on FOPL, front of action labeling, in fact. So we have gathered stakeholders right from medical fraternity to the nutritionists, to the general public, to public health experts, to government stakeholders. So it's a matter of gathering people who are like-minded people who support your cause, and definitely they will see your win as their win. I think that's a critical area.
Thank you so much. We have new questions. We are only going to ask only one more question to close the panel, and then we are going to answer the rest of the questions by email. And the question is related to the replacement and comes from Luciana Castronuevo, one of the panel discussants, who is asking if you face challenges related to TFA replacements in your country. Please be brief, but I think it's a very important question to consider for the discussion. Marianne or Ashim, go ahead.
Thanks, Daryl. I'll start real quick here. With regard to Luciana's question. Well, I'm sure we're not unique in the Philippines in facing challenges on identifying what the appropriate alternative oil should be. But I think, and the challenge is specifically with regard to aggressive lobbying, of course, of certain groups on trying to fill that space that PHO will leave behind. How we're trying to address it is staying true to our position, to our role as advocates, in providing a fertile space for conversation, a fertile space for research to grow and to develop, to be able to actually place government in a position to decide and make determinations for itself on what the healthier alternative should be. So that's it on my end. I'll turn over to Ashim now.
Yeah, very briefly, in fact, I'll give you the India case study. In fact, India uses 11 varieties of oils, in fact, for cooking. So substitution here in India is not at all difficult, in fact, but the recent research points out a very close substitute in terms of taste, textures, etc. In terms of cottonseed oil, which is again a very common oil here, in fact. So I think there are substitutes available. As I said, India, it's not a major issue, in fact. But then in many countries, maybe, but then, the vacuum can be easily filled up by other edible oils available in the market.
Well, thank you so much. We are closing the webinar. I want to say a huge thank you to Marianne and Ashim, our panelists, and Gemma and the rest of the team at GAGI that support us to organize this webinar. Also, I want to say thank you to the discussant panelists from Argentina, Nigeria, and Bangladesh for the questions and recording the messages. I want to close this webinar saying that TFA regulations are essential to protect the heart of the population, are essential and important, but not enough. So we need to consider TFA policies as part of a comprehensive food policy with the same coherent approach to include other food policies, because the fact that products are trans fat free not necessarily means that they are healthy enough. They could continue being ultra processed products, high in sugar, in saturated fats, in sodium. So we need to have a comprehensive approach, a comprehensive and coherent approach. So thank you so much again. We will send the materials Gemma shared, we launched in this World Heart Day, and follow up with the questions that we couldn't answer during the webinar. Thank you so much.